questions should I be asking as an associate interviewing for a new job or negotiating my compensation?
Do I go to work right away to make that money, or do I eat the opportunity cost of starting a few years later so I can enjoy the prestige and income of being a specialist?
What are you guys wearing at the office? I'm more comfortable in scrubs, but I also feel like it's easy to mistake me for one of the assistants since I'm a new grad. What piece of advice were you given early in your career that had the biggest impact on you?
We received so many emails, DMs, and comments with requests to answer your burning questions on the pod.
And today we're doing something really fun. Backed by popular demand, it's our second Ask Us Anything episode.
Welcome back to Project Confidence, the podcast where we share insight, humor, and reflections from two dentists who want to help you build the life and career that you deserve.
We're your hosts. I'm Dr. Amrita Patel.
And I'm Dr. Diana Nguyen.
And today we're doing something really fun. Backed by popular demand, it's our second Ask Us Anything episode.
That's right. We received so many emails, DMs, and comments with requests to answer your burning questions on the pod. It's incredible how many of you reached out to share some of the same challenges that you're having or concerns that you have been nagging at you in your careers.
Yes. So thank you to everyone who sent in questions or feedback.
All right, let's get into the first question.
Okay. Our first question comes from Shireen in Irvine, California, who says, what questions should I be asking as an associate interviewing for a new job or negotiating my compensation that's actually related to what I'm going to be paid? This is such a good question because the way associate compensation is explained can sometimes be intentionally confusing.
Yes, dental job ads love phrases like competitive compensation or high earning potential, but those phrases don't actually tell you what your paycheck will look like.
So when you're interviewing, you want to ask questions that help you understand three key things. 1, how the compensation is structured. 2, whether the practice has enough patient flow. And 3, whether you'll actually be able to perform the procedures that generate income.
Exactly. So here are some questions that are very fair to ask during an interview. First, is the compensation based off production or collections? That's huge. If it's based on collections, your income depends on how good the practice is at getting paid by insurance and their patients.
If the owner says collections, ask if it's possible to be paid on production instead.
Exactly, because production is what you can control. Collections depends on things like the front desk, insurance delays, write-offs, or patients who just never pay their bill.
And if they say no, it's still helpful to understand how their collections process works.
Right. You can ask questions like, how long does it typically take for the office to collect on procedures? Or what percentage of production does the office usually collect?
Another really important one is who is responsible for adjusting treatment plans based on insurance coverage? Because if the office routinely discounts treatment or writes off large portions for insurance, that can directly affect your paycheck. A crown might be billed at $1,500, but if the insurance allows $900, your percentage might be calculated on the $900, not the $1,500.
Another great question to ask is, are lab fees deducted from the associate's compensation? That can be a big one. In some contracts, lab fees come out of your percentage, and that can really add up if you're doing a lot of crowns or implant restorations or removable work.
Here's one a lot of new grads or inexperienced associates forget to ask. How is hygiene production handled? Because in some offices, if you diagnose treatment that hygiene performs, like scaling and root planing, you might get credit for it. And in other offices, you don't.
Another practical question is, how far in advance is the associate's schedule typically booked? Because if their answer is, we're usually booked out for weeks, then that's a very different earning situation than, oh, we're hoping that you can help us build the schedule. That's code for, you might be staring at a lot of empty chairs in the beginning.
And the last question I always encourage new dentists to ask is, what support staff will I have? Because your productivity depends a lot on your team. If you're sharing one assistant with 3 other doctors, it's going to be very hard to produce at a high level.
And a good employer will respect that you're thinking carefully about your career and your compensation.
Here's another one. What percentage of production or collections do associates receive? Typically, you'll see somewhere in the range of 28 to 35%, but that can vary depending on the market and the type of practice. And if the number is higher than that, don't just assume it's automatically a better deal. A lot of new grads hear something like 40% and they think they've hit the jackpot.
Precisely. You want to ask what that percentage is calculated after, because sometimes that higher percentage comes with those deductions. So, for example, if some offices subtract lab fees, supply costs, or even assistant salaries before calculating your percentage, that could be bad. So your follow-up question should be something like, so is that percentage going to be calculated on gross production, or are there expenses deducted first?
Another thing to ask is whether there's a tiered structure. Some practices might pay 30% up to a certain production level and then bump you up to 32 or 33 once you exceed a monthly target, which can be a great incentive if patient flow is strong.
One more question you should be asking once you're talking about pay: is there a daily guarantee? And if so, how long is that going to last? Many associates have a daily minimum during their first few months while they build their schedule, because even if the percentage of production looks good on paper, it doesn't help much if you only have 3 patients on the schedule. The goal is to understand not just the percentage, but what your actual take home income might realistically look like.
That's right. Compensation in dentistry is a little like a math problem. You want to see all the variables before you decide whether the answer makes sense.
Oh, I just thought of another one. Another really important question. How many new patients does the practice see per month? And how are they distributed among providers? This one's really important for specialists because you need to know how these consults and treatment get divvied up, and if they're doing it in a way to ensure that everyone in the office can be productive. So if one doctor is always getting the consults and the second opinions for the PPO patients, and another is always getting the cash patients who already had their consult, that's a red flag.
Or if the owner is keeping all the big cases and giving you emergency exams, your earning potential is going to look very different than what was advertised. Some practices keep things like implants, molar endo, or Invisalign for the owner, and those procedures can make a big difference in your production. And finally, one of the most underrated questions: what did the previous associate produce per month? That question tells you what's realistically possible in that office, because potential income is hypothetical, but historical production is real.
Okay, let's move on to question number 2. Kelly from Louisville, Kentucky asked, I just got into dental school and I'm already stressing out about whether I should go straight into practice after I graduate or if I should specialize. I'm getting all kinds of advice and so many different opinions. Some say that I should focus on getting out and making money right away because I'm going to have so much debt to pay off. I can always pay more to take CE courses and learn how to do any of the more advanced procedures I want to do later on. But then other people are telling me that I'll make so much more money as a specialist and people will respect me more. So do I go to work right away to make that money, or do I eat the opportunity cost of starting a few years later so I can enjoy the prestige and income of being a specialist? Help.
Okay, Kelly, I need you to stop and breathe for a second. You sound like you're spiraling a little bit, and actually, this question is super common. Even practicing general dentists contemplate going back to school to specialize after years in practice.
Let's first say congratulations on getting into dental school. Take some more time to celebrate it and just enjoy it a little because you deserve it.
Now that we've come back to earth, let's address a common myth. Specializing is not automatically the path to making more money. Some specialists earn incredible incomes, but that depends on factors like location, practice ownership, and demand in specialty.
The decision to specialize should really be based in whether or not you feel drawn to the types of procedures and patients that you'll be seeing if you choose that specialty. Then factor in considerations like where you plan to practice, how many days a week you can realistically be working, and how that specialty might have an impact on your lifestyle and day-to-day expectations for work. And if you can afford the opportunity cost of not working for a few more years while you do a residency and potentially having to pay tuition for that training.
Right. So, for instance, you might be thinking that you want to do ortho or pediatric dentistry because you love children and young adults, but consider the fact that because the majority of these patients are still in school and require their parents to take them in for their appointments, most orthodontic or pediatric dentistry offices are open in the hours after school and or on the weekends. If you're someone that likes being done at 5 and never wants to see a patient on a Saturday or Sunday, you might want to consider a specialty that's more aligned with your lifestyle expectations.
So the real question isn't which path makes more money, but it's which career will make me happiest practicing for the next 30 years. We both know general dentists who make way more than specialists. We also know specialists who struggle to find steady work. So as you get further and further into your career, it becomes clear that the clinical dentistry part of your career is only one element that influences how much you'll actually earn.
Another thing people don't realize is that as a general practitioner, you can build a very advanced skill set. There are general dentists doing implants, cosmetic restorative work, sedation dentistry, clear aligners, cosmetic dentistry, all through continuing education. But CE requires time, discipline, and investment. And also, you need to realize that if you're performing a procedure that normally would be handled by a specialist, the dental board of the state you practice in will hold you to the same standard of care as a specialist performing the same procedure. So, if something goes wrong and you wind up in court over a botched implant, root canal, or extraction case, you can't claim that you couldn't deliver a better outcome because you don't have the training that a periodontist, endodontist, or oral surgeon does.
So here's our advice if you're a student. Don't rush the decision. While you're in your first and second year of dental school, pay attention to which procedures you genuinely enjoy. Talk to dentists in different specialties about their lifestyle and their careers. If you're choosing a specialty because it promises a perceived level of prestige or income, trust me, no amount of money coming in will make up for waking up in the morning and feeling a sense of dread every time you look at the patients on your schedule for the day. The goal is to build a career that fits your passions, your goals, and your life.
Okay, we're totally switching gears with this next question. Anisha from Richmond, Virginia asked, what are you guys wearing at the office? I'm more comfortable in scrubs, but I also feel like it's easy to mistake me for one of the assistants since I'm a new grad. I'm petite and I look really young, but dress Dressing up and dry cleaning is so expensive and time consuming, and I'm not a girly girl and I'm bad at putting together outfits. I want to be taken seriously, but I don't want to invest in a wardrobe that's going to break the bank. I love this question because I think every young dentist, male or female, goes through this phase.
Especially if you look young and you're still figuring out how you want to present yourself to your patients.
So I'll start. I wear scrubs and sneakers almost every day. I care a lot about comfort. Dentistry is physical and I'm moving around all day. So for me, it's scrubs, comfortable shoes that I love, and that's it.
I totally relate to the listener who asked this question. Early in my career, I also worried about being taken seriously. When I first started practicing, I consciously chose to dress up a little bit more because I wanted patients to immediately recognize that I was the dentist. One of the things I did was I bought a new white coat and I had it embroidered to say Dr. Diana Nguyen on the front. And I also had a custom badge printed with Dr. Diana Nguyen on it so I could attach it to any scrub top or coat.
That's actually genius because it makes introductions with patients much easier and it helped reinforce your role in the office. Where did you get your white coat?
I actually Googled and found a medical supply warehouse in San Diego where we were living right after residency. And I think I spent like $60 on it. This was years ago before brands like Figs and other companies started making scrubs fashionable. But the point is, you don't have to spend a fortune on clothes to look professional. I see white coats on Amazon all the time at a range of prices and also different cuts and styles to fit any body or budget.
Now, if you want to wear regular clothes instead of scrubs, you can build a wardrobe of simple basics that are interchangeable and can be layered. Things like comfortable pants or skirts, neutral tops, and breathable fabrics. Oh, and please choose fabrics that you can machine wash.
Yes, avoid anything that needs dry cleaning or ironing if you can. Dentistry is so messy and practicality matters. Also, comfort, movement, and safety are still key. I look for stretch and silhouettes that I know are flattering on my body, whether I'm standing or sitting down, because in patient care, you're bending and leaning, sometimes running from one operatory to the next.
Another tip, if you're not great at putting outfits together, Pinterest and Instagram are amazing for inspiration. Do a search for keywords like office outfits or work attire. There are influencers with accounts dedicated entirely to showing you how to dress for work, and most of them are doing partnerships with brands that are very accessible and affordable. A lot of those posts include links to the items they're wearing or suggesting, so you can go directly to the site and purchase.
Oh, and here's a trick. You can do a reverse Google image search on those items to find similar versions at different stores at different price points, so you can look polished without spending your entire paycheck.
Next question. Craig from Boston, Massachusetts asked, what piece of advice were you given early in your career that had the biggest impact on you? I love this question.
Amri, what comes to mind for you?
So the biggest and most important piece of advice that I got clinically was, if it's not written, it's not true. And what does that mean? That means that the patient that comes to the office with muffins every time they show up, the family that has been coming to the place that you work at for generations, your assistant that maybe you take on as a patient, every interaction you have with everyone must be documented, because if everything goes sideways, your documentation is the only thing that's going to protect you.
That's so true. What a great story.
Thanks. What about you?
The longer I practice and the longer I've been alive, I've really come to understand how true it is when people say that rejection is redirection. I think early in your life and career, when things are just starting out, you're going to hear no a lot. Like, you'll go to interviews and they'll say that they're just looking for someone more experienced, or they just ghost you entirely. And then you find out that you got passed over for someone with even less experience, or someone who had a connection who helped them get the job or make the deal. And it's really easy to just kind of sit there in your disappointment and marinate in this feeling of just not being good enough. But the truth is that if you don't get something that you want, whether it's a job offer or an award or recognition, it probably means that better things that are more aligned with what you can do and what will serve you best are still out there. But you should always be proud of yourself for going after what you wanted, because the lessons that you learned from that loss can help set you up for success later on.
That's right. You just have to trust the process sometimes. These were really awesome questions, weren't they? I'm really amazed at how inquisitive our listeners are.
I know. It's wonderful to see so many students and early career dentists taking initiative and trying to map out a plan for success.
Thanks for listening to Project Confidence. Remember to like, follow, share, and subscribe for more.
If you've got a question you'd like for us to answer on a future Ask Us Anything episode, send us an email at projectconfidence@gmail.com or find us on Instagram @projectconfidence.
See you next time.
Bye.